My name is Sam Lévy. I am a professor of cardiology at the University of Marseille, France. And I am here at the symposium on atrial fibrillation and heart failure, the ugly and the nasty. And I just have presented this morning a work that I was asked to do is regarding the differences between paroxysmal atrial fibrillation and persistent atrial fibrillation. And I talked about the nomenclature, the classification, and the important things, finding that we had was that paroxysmal atrial fibrillation occur in patients who are younger than those with persistent atrial fibrillation, and the paroxysmal atrial fibrillation are also patients are also more symptomatic than the other one, the one with persistent or permanent atrial fibrillation, and the risk of stroke is similar in patients with paroxysmal and persistent atrial fibrillation. However, the morbidity and the mortality associated with stroke in persistent atrial fibrillation is and the outcome is less good than with paroxysmal atrial fibrillation. So there are some differences between these two forms of atrial fibrillation, although there is some overlap between the two forms of atrial fibrillation. So this is the main message that we can bring by the alpha study, which is a study that we did in atrial fibrillation in several regions of France.